Breast cancer is the most common cancer in women, and the number of cases increases every year, especially in low and middle-income countries, where breast cancer survival is lowest. The ABC-DO study is the first multi-center breast cancer cohort in sub-Saharan Africa. It follows up more than 2,000 newly diagnosed breast cancer patients in 5 sub-Saharan African countries, from first symptom to diagnosis, treatment, and unfortunately, often death.
ABC-DO stands for African Breast Cancer Disparities in Outcomes Study. This relates to the large disparities in breast cancer survival outcomes, both between sub-Saharan Africa and the industrialized world, but also within sub-Saharan Africa itself. The main aim of ABC-DO is to understand reasons that underlie these differences in survival rates in the sub-Saharan Africa region and to identify its contributing modifiable factors in order to inform the most effective strategies to improve survival rates.
In sub-Saharan Africa, about 1 in 10 women die within 6 months from a diagnosis of breast cancer. And this percentage increases to 50% 3 years after diagnosis, with important between-country disparities, where 90% of Namibian white women are still alive 3 years post-diagnosis, whereas in Nigeria it remains only 36% survivors. The number of maternal orphans exceeds the number of deaths from breast cancer among women in sub-Saharan Africa, as many women who die are younger than 50 years of age. This raises issues for the future of these orphans, as cancer treatment expenses limit families' resources to care for them, contributing to the intergenerational cycle of poverty.
The breast cancer journey of women in sub-Saharan Africa is characterized by an accumulation of disadvantages with a strong social gradient. Due to a longer pre-diagnostic journey, breast cancer patients in sub-Saharan Africa present late at the hospital when the disease is already in an advanced stage with poor prognosis. In countries without breast cancer screening, a year can pass in between first symptom detection and hospital presentation, which leaves a tumor too much time to grow. The factor most contributing to this delay was the non-recognition of symptoms due to low breast cancer awareness of both patients and health professionals. Once at the hospital, the cycle of disadvantages continues, especially in countries with no universal health care. In Nigeria, up to 40% of women did not receive treatment for breast cancer within 1 year after diagnosis. In contrast, in Namibia, where universal health care exists, not a single woman was left untreated.
We hope that the ABC-DO study will help to inform policy strategies to raise breast cancer awareness, to promote early diagnosis, and to improve breast cancer treatment resources in sub-Saharan Africa. We also hope that ABC-DO will raise awareness about the devastating social dimension of breast cancer deaths in sub-Saharan Africa, the family and children left behind, and the related cycle of poverty. We are very happy that the knowledge generated by ABC-DO will contribute to the Global Breast Cancer Initiative, a global program to reduce the worldwide breast cancer burden launched by WHO this year.